More young people are being referred to mental health services than ever before.
Waiting times are too long, access far too difficult.
And they actually said to her, you're not ill enough to be referred to a specialist eating disorder service.
This hospital was closed in 2023 after Sky News uncovered disturbing evidence about the treatment of young people. Everyone knew the hospital was failing, yet nothing changed.
There was a huge culture of covering things up.
Sorry, you're not actually bad enough to help, so we're going to take you off the list because you're not bad enough. And then they were like, well, okay, we do think you're bad enough, but you're actually too bad, you're beyond our help.
Are you having any suicidal thoughts? You are. Okay, right, well, I can't help too much with that because that's beyond what I'm allowed to do in this room.
What I think's happening here is you've been watching too many TikToks on, mental health and everything.
Back when I was a teenager stacking microplastics on my wrist and drinking Monster in the park, I was also receiving counselling under the care of Child and Adolescent Mental Health Services, otherwise known as CAMHS. And if you've heard of this service, you might have heard mixed reviews. Go to some spaces online and you'll find positive experiences. Go to others and you'll find negative experiences, especially on TikTok, where in the last few years, young people have flocked to tell their stories about CAMHS, giving the service such a bad reputation that it's even been mentioned in some academic research. If you've noticed young people talking more and more about mental health over the years, that's because the situation is kind of dire over here. We have seen an incredible rise in mental health issues in young people, and the NHS is buckling under the weight of it. But before we get any further into it, if you find yourself enjoying this video, please give it a like and subscribe to my channel. My Instagram and Substack are linked down below, as well as my Patreon, where we have a monthly book club and other perks. Okay, now who wants a story time? I was referred to CAMHS in 2010 when I was 14 years old for low mood. And I was under the care of CAMHS for 2 years, and in that time I had some individual sessions and some family sessions, but I don't ever remember being asked if I was okay with that. I just remember being told that that's what was happening. And I had one counsellor throughout that time who I didn't dislike, but now in retrospect I can see that I had just had zero rapport with, and I didn't trust her. She called me by the wrong name multiple times, told me I had a problem with authority because I questioned the behaviour of adults around me. She didn't notice the visible weight loss I had due to an eating disorder that I developed while I was with CAMHS, and I didn't find this counselling helpful at all. There were things I didn't tell this counsellor about, and maybe if I did tell her, that my outcome would have been different. But at the same time, the reason I didn't tell her certain things was because I didn't feel safe or comfortable around her. Repeatedly calling a teenager by the wrong name tends to do that. I was discharged when I was 16 because CAMHS believed that I had improved, but my GP referred me back to mental health services when I was 17. This time it was for CBT, which is cognitive behavioural therapy, and this is kind of the first port of call for anything anxiety and depression related, and on the NHS is typically offered in the form of a short course. Now, I honestly can't remember what happened here. It might have been that I had CBT with CAMHS, but they wouldn't allow me to extend my sessions because I turned 18 within that time frame, or it might have been that I had CBT with the adult mental health services, even though I was 17 when I was referred because I was about to turn 18. Does that make sense? So I can't remember which one it was, but I think it was one of them, and I'm going to share this next experience anyway because it's a good chance that it happened under CAMHS. I only found out within my first CBT session that I'd only be getting 6 sessions in total. I thought it was going to be longer. These CBT sessions were a blur to me, and that's because I don't think this therapist asks me more than a handful of questions about myself the entire time. Sometimes he would talk at me for the full 50 minutes and I wouldn't even say anything. I would leave in a bit of an exhausted daze, wondering what exactly I was supposed to be taking away from this therapy. It wasn't until several years later where I learned that in CBT the therapist should be asking lots of questions about you to try and understand why you think the way you do, and then offering you tools. This therapist did not do that. He referred to some of the sessions I had with him as motivational speaking, and even told me once about his child's friend who had been assaulted, which literally had nothing to do with the reasons I was seeing him. Truthfully, God fucking knows what this man thought he was doing in these sessions with me. And I wish I could put in a complaint about him, but I think it's been too long now. So that was my experience with CAMHS, and I don't feel like I had a particularly helpful or worthwhile experience. Although nothing ever really bad happened to me under the care of CAMHS, I do ultimately believe that they failed me and critically didn't notice the signs of my mental health getting worse while I was with them. There are a lot of people out there with stories similar to mine, and sadly a lot worse, and we're going to get onto some of those stories, but before that I think we need some context around the mental health system in the UK.
Hi, my name is... What? My name is... Who? My name is...
Jeremy Cunt.
In case you're not from the UK, the NHS is our national health service and it's free. We are very, very lucky in the UK to have free healthcare when many other countries don't. And we have a very slay left-wing politician named Honorin Bevin to thank for that. It was 1948 when the NHS began, and even though we say it's free, we do obviously pay for it through taxes and national insurance.
You'll have the advice of your own doctor. If you're ill, you'll have specialist services if you need them, without worrying about the cost.
That's more like it.
At one point, the NHS was renowned as the best healthcare system in the world, but that's not the case anymore. 2012 was a really pivotal year in the UK, and not just because Carly Rae Jepsen released a banger, I threw a wish in the well, but because the Health and Social Care Act was introduced, which made the most significant and controversial changes to the NHS since it began.
And this is what the Act does. Fundamentally, the Act removes the 60-year duty on the Secretary of State to secure and provide healthcare for all citizens throughout England. They've abdicated themselves of responsibility for our NHS, dedicated to a new market bureaucracy, bringing in insurance structures modelled along the US lines, and above all, it gives powers to new providers and insurers to pick and choose which patients will get treated.
A new healthcare secretary was appointed in 2012 named Jeremy Hunt, and if you're not from the UK, you might imagine what his nickname is here.
Jeremy Hunt.
The paper says the Health Secretary, Jeremy Hunt,
has decided that Jeremy Hunt...
You're backing Jeremy Hunt. I'm so sorry, Jeremy Hunt. I've never said that before in my life.
Among other things, as his 6 years as health secretary, he began outsourcing more NHS contracts. But what does that mean exactly? I don't know about contracts, I only know about gays. Just kidding, I know about both. A lot of people would call what Jeremy Hunt was doing privatization, and I know it's boring, okay, but they make it boring so we stop paying attention. Privatization in the NHS is essentially when a hospital or a service is publicly funded but privately owned. This means the healthcare is still free. It's not necessarily private healthcare where the patients have to pay for it out of pocket. But what the NHS is doing is paying a private company to deliver an NHS service, manage a hospital or service for them. The idea being that it will take pressure off of the NHS. Sounds good, right? Just you wait, buddy. While Jeremy Hunt was in charge, he outsourced a huge amount of these contracts to a company called Carillion. Carillion owned a clinic called Clinicenter, and in 2012 to 2013, this clinic was found responsible for 3 patient deaths who were only going in for routine operations, so they shouldn't have died. It failed multiple inspections by the Care Quality Commission and lost thousands of patient records. Despite this, Jeremy Hunt awarded Carillion with more contracts until they collapsed in 2018. Seems a little bit strange.
If you ask me, this was arson.
Arson?
Aye, someone arsing around.
Why would Jeremy Hunt do this? Well, maybe our Jez was an optimist and just had faith in Carillion. Or maybe this was a case of pure mismanagement. Or maybe it was because Philip Green, one of the owners of Carillion, who made a small fortune from the company, also worked as a business advisor to the Prime Minister at the time. Although Jeremy Hunt is no longer Health Secretary and we're currently under a Labour government, the outsourcing or privatising that has increased since 2012 has had a long-lasting impact on our NHS, which includes mental health services, which includes CAMHS. So if you've had a bad experience with CAMHS or the UK mental health system in general, some of the things in the next section might sound a bit familiar. So what are the problems that people believe privatisation causes?
I don't want peace. I want problems, always!
Number 1, a two-tiered health system. Some people argue that privatisation causes a system where wealthier people are able to dodge any problems in the NHS and just go completely private for that healthcare, when poorer people are forced to put up and shut up with a crumbling NHS. Number 2, cherry picking patients. When involving private companies in the NHS, it can allow these companies to be very selective over who they want to treat. Even though it's NHS care, these companies get a say in who they want to take on. And remember, these are private companies at the end of the day. They care about profit. We might assume that some of these companies will be looking for patients with the easiest and cheapest needs, leaving more complex and expensive patients to an already underfunded NHS. Number 3, profit over care. There have been reports of private companies facilitating NHS care having a huge focus on cutting costs for their own benefit, which of course will hinder patient care. We only have to look at Carillion for an example of how that can happen. Number 4, increased wait times. One of the major criticisms people have about the NHS in recent years are the absolutely shocking waiting lists. Some people are literally waiting years to get treated. Long wait times aren't just an inconvenience. People's symptoms are actively getting worse during that time. And I suppose that is something that outsourcing to private companies can be useful for. But one argument is that by doing that at such a high rate for over a decade, when many companies seem to be prioritising profit over care, has drained money from the NHS. As a result, the NHS has struggled to keep up with the rising demand, leading to longer wait times, or having to outsource. And if you're still not convinced that privatisation is a bad thing, this is a graph of avoidable deaths in the NHS, which you can see goes up when outsourcing to private companies became more common. I wish that I could show you a graph of deaths within child and adolescent mental health services, but I can't, because that data doesn't exist. As of right now, there is not and never has been a single body or government department responsible for recording child inpatient deaths. I have a whole section on young people's inpatient treatment coming up, so more on that later. So I shared my experience with CAMHS with you earlier on in this video. Oh God, it's hot. And in the process of making this video, I asked you guys, people who follow me here on YouTube and also over on Instagram, if you had any experiences with CAMHS and if they were good or bad or mixed or neutral. And I got way more responses than I thought I was going to get. So I thought that I would actually just read some of them out. So this person says their experience of CAMHS services was a bit of a roller coaster with positive and negative experience. When I was in primary school, before austerity had really set in, I got referred and seen in 2 weeks, and despite at the time being in an incredibly dark place for a child of that age, all of my memories of the service were really quite positive and helpful. My psychiatrist was really lovely. Speaking now to my dad about it, he has only good things to say about them then. I was then discharged a year later after doing loads of therapy and having my meds monitored by my GP. Quite a good experience from this person. Then they go on to say they were re-referred in 2021 and it was genuinely awful. After I presented to A&E having attempted, my first referral was flat rejected for some reason. Then my GP basically wrote to them saying, "Are you sniffing glue?" I've heard a lot about this, about people, children and adolescents clearly needing help, clearly needing to be referred to CAMHS and being rejected. I've heard loads about that. And 2 months after the initial crisis, I got onto the waiting list. I waited another 4 months after that, in which I attempted again before I saw a psychiatrist. Someone else says that they don't have personal experience, but they've worked for 4 years as a SEND teacher, and none of the experiences they've heard about have been positive. This person says they first got referred to CAMHS when they were 14 in 2010, which is the same as me, and they say it was after a sudden, seemingly unexplainable act of self-harm, and was seen relatively quickly, which was 3 months, after which the CAMHS team did not offer me any further meetings, as the self-harm did not occur again after the initial incident, and that the act of self-harm must have been an overreaction to something. If they said that to you, that's wild. About a year later, this person was referred to CAMHS again for the same thing. It was a little bit worse this time around. This time they had to wait 6 months to be seen, so twice as long as the previous year, and again were not offered further support. 1 year later, the same thing, except this time it was an actual attempt. They were fast-tracked, so only had to wait 2 months. I was finally offered regular sessions of adolescent CBT, diagnosed with unipolar depression and put on fluoxetine. Another year passed, things weren't getting better for this person. They say the CBT was long, giving me homework, lessons on how I should think about things, how I should behave in situations, what methods I should employ when I'm feeling abnormal. I wanted to be fixed, but something wasn't right. I found myself coming up with my own methods of coping, but then being told I wasn't doing it correctly and I should follow the sheets. This person said over a little bit of time, they did eventually get a little bit better. And when they turned 18, CAMHS stopped the sessions and convinced them they were totally fine now. This is another thing that I think is a problem, like the transition between CAMHS services and adult services. That I have heard a lot of cases of people just being dropped as soon as they turn 18 and there being like no transitional help. This person then went away to university and sought out mental health treatment there as well. One of the mental health guys I had told me to stop letting this disease control you and start taking on life. Without questioning my past experiences, I've also had this, like mental health professionals or GPs even, saying stuff to you, making blanket overarching statements to you without knowing much about your past, so not knowing if that piece of advice is going to be relevant. Eventually in 2020 I had a new therapist and she was the first to ask me the obvious question, have you ever been tested for autism? This person then goes on to say how they eventually get tested and diagnosed with autism and how a lot of their problems were actually down to being autistic and not getting the exact help that they needed. A lot of people make this criticism of CAMHS about how they're not very good with integrating or like thinking about neurodivergence like autism and ADHD. They just kind of think about diagnosable mental illnesses and operate using that framework. Things should actually probably be a bit more integrated to give people like this person a better chance at like getting better and like living a fulfilling life. Okay, so let's wrap up with what overall are the problems with CAMHS, but also a little bit of a defense of CAMHS as well, just to make this video fair. This video is interrupted by me. What if I told you you could join the thought.bug Patreon and get perks like having your name in the video credits, bonus videos, and a book club? Well, that would probably just knock your socks off, wouldn't it? It would knock my socks off though. Do you know why? Because I'm a bug. Please join the book club tier so I'm not alone. There are different price points for different budgets, even one for less than a cup of coffee. And if you could help fund this channel, you will have my eternal gratitude as well as all the perks I literally just mentioned. Are you listening? Hello. Join Patreon today with the link below. So I've talked about my experience with CAMHS and we've listened to some audience members' experience with CAMHS. Earlier we spoke about the general problems people have with privatization within the NHS, but now we're going to specifically list the problems with CAMHS. And after that we'll be talking specifically about the problems within child and adolescent psychiatric hospitals, which are absolutely unbelievable. The first and probably the most obvious problem that people have with CAMHS is the waiting times. In 2023 to 2024, the average wait time after being referred to services was 392 days, which was a 52% increase on wait time of the year before. Another problem is the transition from child and adolescent mental health services to adult mental health services, which can be confusing and disruptive. In 2019, a study found that 25% of young people did transition to adult services. Another 25% stayed at CAMHS even though they were technically too old. And then there were no records of the other 50%. 50% of young people slipped through the cracks. There's also the postcode lottery element to CAMHS. And if you don't know what that means, it's when trusts in different regions have slightly different rules or resources, meaning a child's care could be vastly worse in certain areas of the UK compared to others. For example, Isle of Wight spent 10 times more per child than Hulton did. Finally, the thing that I hear most of all is probably the most contentious one, and that means we have to talk about it. And that is that sometimes CAMHS therapists can be a little bit shit. And to be honest, when you hear some of the stories that people have about their time at CAMHS, it's kind of hard to argue with that. The vast majority of people who live in the UK love the NHS and celebrate and praise people who work for the NHS, me included, so it can feel difficult sometimes to criticise NHS staff. But the truth is, not every CAMHS therapist is good at their job. Weirdly, a common experience among CAMHS kids is being told to have a cup of tea or have a bath when you're feeling suicidal, and being told to swap words like depressed for low mood. Low mood, low mood. Maybe you have low mood, Susan. Can this always be blamed on understaffing and underfunding? Chances are there will be a few people watching this video who work for CAMHS or have done in the past, and I definitely don't want to make you guys feel bad. Of course, in any job you're going to get some people that aren't very good at it, but I do believe that most people who start working for CAMHS do so because they really want to make a difference in children's lives. And that's why I want to highlight some of the reasons that CAMHS workers might not be able to do their best work despite their best efforts. And those reasons are increased demand with decreased funding. Research shows that young people's mental health in the UK is literally worse than ever. Yes, things were made worse by the pandemic, but things were bad before that. From 2019 to 2023, there was a 53% increase in referrals to CAMHS crisis teams. The demand for CAMHS is so huge, in 2021 to 2022, trusts were forced to raise the threshold for treating children purely to get through the backlog. NHS funding has not matched the demand for services, and I do feel for CAMHS staff about that. I think it's easy to fall into the trap of thinking therapists and clinicians are superhuman and don't make any mistakes, but it's only fair to remember that they're people just like everybody else. Even when a CAMHS therapist loves their job, they're still going to get tired by Friday night or not want to stay late every night so that they can go home to their family. Mental health professionals only have so much to give, and when the hours are long, expectations are high, and caseloads are intense, it's understandable that CAMHS staff might experience compassion fatigue or burnout. And this is when a therapist might struggle to empathise with a patient, for example. One study showed over a third of CAMHS staff is struggling with moderate to high levels of work-related burnout. With mental health issues in young people skyrocketing, this might mean that CAMHS staff have an increased workload on the same amount of pay, so that exacerbates the problem. Another reason is lack of staff. With the pressure of increased demand, not enough funding and compassion fatigue, it's no wonder that CAMHS staff are quitting, and it's been a struggle to recruit new staff members. As of February 2025, applications to study nursing were at an all-time low. Rates have dropped since Brexit and the Conservative government's scrapping of nursing bursaries. There's also the fact that CAMHS staff can get better pay and better work-life balance in the private sector. Like I've already mentioned, mental health professionals are people too, not superheroes, and even though most of them are passionate about the work that they do, it's reasonable for them to still want a nice life for themselves, meaning being compensated fairly for the work that they do and actually getting a life outside of work. It makes sense that a lot of therapists have left the NHS and are pursuing careers as private therapists or having complete career changes. The incentive for them to continue working for the NHS is simply not there. 14-year-old Ruth Szymankiewicz was an inpatient at a mental health facility for young people when she was found fatally injured in her room in 2022. Ruth was meant to be under constant supervision, but the staff member assigned to her left her alone for about 15 minutes. It was that staff member's first day on the job after being recruited from an agency, and it was later found out that he managed to get hired with a fake ID, and he fled the country after this. This is such a devastating story. I couldn't really comprehend it when I was first reading about it. Ruth was at one of the Huntercombe hospitals, a hospital group that was privately owned but delivered NHS care. They've received almost £190 million in NHS contracts since 2015.
These are the numerous critical reports which were published, including 3 in the year leading up to Ruth's death from the care regulator, the CQC, highlighting significant and repeated failings.
Several Huntercombe hospitals have been accused of abuse and appalling standards of care, such as staff overusing restraints and tranquilizers, not doing observations or checks properly, forced feeding, mocking and laughing at patients, little to no therapy actually being given, and even allegations of sexual abuse.
I've heard so many similar stories of it happening to so many people, and I was obviously lucky in a way, but you know, it could happen to anyone. It could still be happening out there.
3 Huntercombe hospitals have had to shut down, but there are still 2 running under the new name of Active Care Group. Sadly, Ruth's case is not the only one of its kind. Chelsea Mooney was also meant to be under constant supervision with Signet Healthcare, but there had been an unjustifiable delay in checking on her, and that is when she fatally Grace Smith had her constant supervision reduced to 15-minute intervals without appropriate risk assessment at St Andrew's Healthcare when she took her life. It's a struggle to think about how Ruth and Chelsea and Grace must have been feeling before they were admitted to these hospitals, let alone during them being there. Every child deserves to be safe and respected and nurtured, and I am so heartbroken for every child that didn't receive that under CAMHS care. I will leave links to Ruth, Chelsea and Grace's stories down below so you can go and learn more about them, what they went through and statements from their parents. In my opinion, the way that these NHS funded but privately owned hospitals seem to run is more like a business, like a restaurant or a shop, not a hospital. The way that they change owners and rebrand and rename themselves. Previous owners get to just move on to a new company, a new job. And evidently the thoroughness in which they background check and train their staff isn't to the standard that you would expect from a hospital. The fault, however, doesn't lie only with these hospitals. The Care Quality Commission is England's independent regulator of health and social care. So they're responsible for doing things like inspections, giving recommendations to improve, deciding whether a unit is fit for purpose, and ultimately shutting them down when needed. Between 2017 and 2022, they received over 700 reports of serious safety concerns at the huntercombe group, and they had to issue warnings over inadequate care multiple times, and yet nothing was done to fully address the problems. A former executive at the huntercombe group, Philip King, even said himself that the Care Quality Commission and the NHS should have closed the hospital that Ruth was in years ago. The responsibility here doesn't just lie with individual hospitals. The Care Quality Commission's whole existence is to ensure that these hospitals are safe, and they failed at that. CAMHS hospitals seem to have all of the problems as outpatient services, plus the problem of having to rely on agencies for ad hoc nurses and support workers. This is because the vacancy rate in these hospitals are fairly high, and obviously they still need nurses and support workers for day-to-day running, but agency staff don't know the patients or their care plans. It's the regular permanently employed nurses and support workers that should know that stuff. We also kind of have to talk about the qualifications and training required to be a support worker in a CAMHS hospital. Let's look at this job ad I found on the NHS website today. CAMHS clinical support worker, requiring hands-on care in the prevention, management and de-escalation of violence, therapeutic engagement with patients, and open, honest and non-judgmental one-to-ones, all on a salary of around £24,000 to £25,000 per year in London. Those are some very big asks on a very little salary. Okay, well, what about the experience needed for a role like this? They require a care certificate, an English and Maths GCSE, 1 year's experience, and some soft skills. I acknowledge that support workers play a huge and crucial role in healthcare, but am I the only one that's slightly shocked at how little experience is needed to work in an inpatient setting with extremely vulnerable children? I'm certain that there are CAMHS support workers that go into the role with very little experience and are amazing at it, but sadly, as we heard earlier, that is clearly not always the case. Another huge problem surrounding CAMHS hospitals is something that I mentioned earlier. There is no single body or government department responsible for recording child inpatient deaths in the UK. There's a charity called INQUEST who submitted freedom of information requests to various psychiatric hospitals in an attempt to find out the number of child inpatient deaths. And although some hospitals replied and were honest, private companies don't actually have to answer freedom of information requests. So many of them refuse to give out this information. So at the moment, we definitely know that 20 young people have passed away whilst in mental health hospitals from 2019 to 2022. But in reality, the number is probably higher than that. Okay, so what exactly can we do about all of this? Now, this is just my opinion, but I think there might need to be a bit of reimagining about what the mental health system should look like. I think there definitely needs to be less tick boxing, less bureaucracy, and less of a one-size-fits-all approach, and instead approaching young people in a more holistic, individual way. Just because CAMHS is made up of mental health professionals, I don't think it completely escapes the adult notion that children's feelings and experiences are not as valid as adults. And I talk about the idea of adult supremacy a little bit more in my wife swap and super nanny video. I also think there needs to be more of a push towards community care when possible, rather than jumping straight to inpatient treatment. And I think that that is really wrapped up in this cultural fear and misunderstanding we have around suicide, which could be an entire video in itself. We need to start regarding children and young people with mental illness as knowledge holders, as people that should be listened to so we can learn from them, rather than viewing them as troublesome or unruly teenagers that will eventually grow out of their behaviour. There clearly needs to be a bigger focus on intervention and prevention of mental health issues, rather than waiting for a child to get ill enough to meet certain criteria and then treating them, and possibly even calling them challenging or complex if they don't respond to treatment once they're ill enough. A lot of these things ultimately come down to funding, and that's why it's crucial that we vote for a government that is going to properly fund the NHS and children's services and appropriately manage them. I also think the government and the NHS need to be reevaluating how they pay support workers and what they expect from them. The idea of low-skilled labour is a classist myth, and even though the value of support workers is not reflected in their pay at the moment, we need to understand that support workers are not babysitters. They're professionals with important skill sets. NHS trusts should be hiring people with a passion and a drive for roles like this. If you want to check out the organisation First Do No Harm, I'll leave their website and Instagram in the description down below. They're a UK-based user-led collective who have lived experience of child inpatient services. They do campaigning work around this and have a Facebook support group for anyone affected. I'm also going to leave information down below on how to submit a subject access request to the NHS if you would like to receive your own records from your time at CAMHS. I know for some people that can feel really helpful in processing what happened to them. And that is the end of this video. Thank you so much for watching. Please like this video and subscribe to my channel because it really does make a huge difference. And thank you so much to my current Patreon supporters. I will leave my Patreon down below as well as my Instagram and Substack. And this month on the Patreon book club, we are reading Rouge by Mona Awad. And previously we have read The Vegetarian by Han Kang and also The Pisces by Melissa Broder. So that is the kind of weird, creepy vibe that we're going for over there. A book with an unhinged female character hates to see me coming. I will see you in my next video, I guess. Bye.